For those who don't know me, I'm Deb Savaris, the CEO at the Centre for Excellence in Child and Family Welfare. Suffice to say, we're all working remotely, and it's been amazing to watch how people have been able to make that adjustment, painful that it might be for some of us, extroverts like me. But I'd like to also acknowledge that we're on Aboriginal land of the Wurundjeri people of the Kulin Nation, and acknowledge elders on the Zoom, elders in our community, and elders from other cultures. But first of all, I want to say thank you for coming to this Zoom gathering today, and thank you to Sonia Sharp from EY, who jumped on the opportunity to start to have a conversation with those of us in our sector, so that for those of you who are not too busy, you might be able to spend an hour or a little bit longer than an hour to have some reflection from Sonia, some global perspectives about what's happening around the world and how we're all adjusting in the human services space to the COVID-19 pandemic. Because as you can imagine, whilst it's pretty serious here in Australia, it's very serious in other parts of the world, and we are all having to make adjustments. So we thought it might be useful to just have an opportunity to listen to Sonia, and also then have a bit of an exchange with each other about what's happening for you now, and what this sort of looks like for the future. Now, this is one of many conversations we'll be having. I've got some of my staff zooming in as well, and they'll be taking notes. And then Sonia, myself, will go away and reflect further on what else we can offer you. We are finding that whilst it's really busy and crazy, people still have time to have these conversations. So that's, which I think is very important, given that we're all a bit isolated. So is that a good place to start?
It's a great place to start. Thank you very much.
So it doesn't surprise me that we've got Sonia out of the gates, prepared to do this with the centre. And I might now, on that note, hand over to you, Sonia, and thank you very much for being such a great friend of the centre. Thank you.
That's good. That's smashing. Can you all see me and hear me okay?
Yes.
Good, excellent. So, so first of all, I also would like to pay my respects to the traditional owners of the land that we're actually the varied land that we're all meeting on today in our different places, wherever we're dialing in from, including paying my respects to elders past, present and emergent, and any Aboriginal and Torres Strait Islander people on the call with us today. So yes, thank you very much, Deb, for facilitating this. We had a conversation about how the kinds of issues and things that we're seeing across the sector, and thought it was timely to share. And you're right, Deb, we're all keen to share our insights and talk about our uncertainties and the solutions that we're finding as we navigate this strange space. I've also got some people online with me who are a bit behind the scenes at the moment, but when we get to questions and answers may join in the conversation. So I've got my Cameron Bird, who some of you will know, who's a partner also in EY, who does a lot of work across the human services sector, particularly in terms of housing and disability. Dean Yates, who many of you will know from his time in government, and is also a partner with us at EY, and Georgina Gates and Melinda Lith. So anyway, so a little bit of a team of us ready to answer any questions. We've also got a pack that we can share with you later. As is the way with technology, we've just been let down with a little bit of a glitch at the last minute, so at some point it'll come online, but we can do without it for the time being. But first of all, what are we seeing? Well, we're seeing some similar, I guess the reassuring thing to start off with is that we're seeing the same kinds of things across many sectors and many organisations. And essentially organisations are falling into three groups at the moment in response to COVID-19, each with their own challenges to navigate. There's those organisations that are essential services, like human services, that have to keep running. And the main workforce concerns that they're experiencing are workforce supply and continuity, staff exhaustion, and keeping people safe and well, the identification of potential sources of workforce beyond existing and traditional employees, including finding different ways of labour portability. A little bit about that later. Moving people safely while adhering to social distancing, and also working with clients safely while adhering to social distancing. And is there somebody on mute? Could I ask everybody to go on mute who isn't speaking? Fantastic, thanks. And building a contingent workforce to safeguard against illness, because we know that that's going to impact on many of us. And talking to colleagues around the world, people are modelling up to 40%, 50% of workforce unable to work at any one time. So resilient services fall into the resilient groups of businesses and services, but there are also two other groups, and we may find ourselves there. There are those businesses and organisations that can reinvent themselves, and those are the organisations that can move to remote working. And I'm going to share with you some examples from elsewhere about how people in children and family services are moving to remote working and are embracing technologically enabled ways of engaging with their clients, or they can reinvent themselves and redesign themselves to different modes of service delivery or even different products. So an example is the brewery here in Victoria that's turned itself over to hand sanitizer, or the VAADA who have started making PPE. Finally, there's those organisations that need to endure, and those are the organisations that have to, because of financial viability, close, or because there is no longer demand for their for whatever services they're delivering, would have to close or go into hibernation. The good thing about this crisis is that we know that it's going to be relatively short-lived. It's not like another global financial crisis. It is going to be, we're predicting that 2021 will be much better. So,
say that again, Sonia.
2021 is going to be much better.
Everybody's laughing.
Anyway, and the three issues that we find in particular that are concern for human services, and we're working with human services around the world as well as across Australia, are particularly for smaller providers, but even some of the bigger providers, staying viable. And my colleagues Cam and Dean and Mel are working particularly with organisations who are really struggling around their financial viability. Staying performance focused, we all have to still keep delivering, particularly when it comes to vulnerable families, and also staying well. How do we maximise the physical safety of employees? And those are the areas that I'm going to focus on in this next little while. I'm going to talk for probably about 10 minutes and 15 minutes, but there is, I don't know how, I'm sure you're all very familiar with Zoom, but there is a chat function. And
yeah, it's down the side.
Yeah, that's right. And I'd invite you to text or send your questions in as they arise for you, because then what we can do, there's a lot of you, we can make sure that we see the themes in your questions and we can answer them collectively, as well as when we kind of talk together later on.
Excuse me, Sonia, Jennifer Webber here. Just to clarify with you, did you want us to send the question to everyone, or was there a particular person that you want them to be going to on that list?
That is a really good question.
I think if you just type everyone, we can also...
Yeah. Okay, great. Excellent. Thank you. Thanks.
Hello, Jennifer.
Hi, Deb.
So in preparation for this session, I actually spent the weekend reaching out to my former colleagues and connections around the world to find out what people are doing in relation to human services, and particularly those countries and jurisdictions that are ahead of the curve of us in terms of the actual virus. So they've got larger numbers, they're already gone into stage 4 lockdown, and have had to really challenge themselves to think differently about the way that they're working. And a reassuring note, I came across a few interesting illustrations of things that people are doing, and I'll share those with you. by and large, everybody is doing the same kind of things that we're doing. Good thing is that we've got a few extra days to prepare, and I say days deliberately because we don't have much time. And it's really, really important that we do move as quickly as we can to use the time we have available to prepare ourselves, our organisations, our teams and our clients to work well through this crisis. So what are we seeing around the world? Well, first of all, we are seeing a delivery model that is moving to virtual delivery wherever possible, leveraging the best technology, but combining that with some good old-fashioned human services, social care practice. So what we're seeing is much more frequent rating of each child and young person known to the system. So red, amber, green. So risk assessing in the context of the new crisis, and in the context that there may be the children may live in a family who are infected with COVID-19. There may be a family which we're seeing who are using the excuse of COVID-19 not to be seen. There may be children who disappear from our radar, but on the other hand, there may be many children who we're very confident will be fine with light touch connection and contact. So that real profiling of the families that we're working with, and knowing who are the ones that we want to be most connected with, and where are the ones where we can maybe go, like, if we know they have good protection.
Sonia, you're falling in and out in terms of the mic.
Oh, am I? Okay, yeah. Righty-ho. Okay, I will move closer. Is that better?
That's much better.
Okay, right. If I do that again, please let me know. So risk assessment, frequent risk assessment, and revisiting those risk assessments as we proceed, because different families will emerge as more or less vulnerable than others. The other thing is a multi-agency approach with school attendance as a key protective factor. And we're very fortunate here, as in some other places in the world, that we're keeping our schools and early childhood provision open for our most vulnerable families. And what we've found, particularly in the UK, who've taken this approach, what they're finding is that is a very useful touch point to connect with children and young people, and is a different place and space for us to engage. And because there's relatively small numbers of children and young people attending, it's easy to have contact with young people without compromising the safety and well-being of the workforce. Third area is staying face-to-face as long as possible, but preparing now for a rapid move to remote. So I was talking to a former colleague over the weekend who yesterday moved the whole of their workforce to remote working, other than connection through schools and other than highly vulnerable families. And when they're having to engage with highly vulnerable families, they're doing that in conjunction with the police. But they have explored very successfully use of telephone, iPad and WhatsApp. So moving quickly to virtual connection, and that includes home visits, so virtual home visits, having the parent or carer do a tour of the house with the device, engaging in telephone conversations or iPad conversations, issuing children and families with iPads where need be, although most people have got a phone. And then for the highest rated children, moving to a doorstep service, engaging with families on the doorstep so that there is visibility, direct visibility of each child, and direct engagement with them. There's also a resurgence of some traditional methods, such as photos and letterboxes, where there is no opportunity for digital connectivity with children and families. The key that came through to me in exploring this has been that case recording becomes crucial. So everybody that I've spoken to has said we have to be much more diligent with our case recording, but they're also finding that the different way of working means that we have more time to do that well.
Sonia, can I just stop you for a second?
Yeah.
Rita and Wendy, you're not muted.
No, I'm muted.
No, you're not, Wendy.
And Sue as well, you're not muted.
Sue's just recording this, so she's probably okay. Thank you, Sonia. Keep going.
Oh, that's great. Okay. The other thing that they're doing is streamlining and adjusting registration requirements. So that's registration approvals for students in their final year of university, as well as the easy re-registration, immediate and re-registration of any social workers who've retired in the past 3 years. They've reduced inspections and anything that would be deemed unnecessary, and they've also streamlined approval of potential foster carers, including looking to the Child and Family Services workforce as a potential source of temporary foster carers and other adults and workers in easy to vet workforces such as teachers, less so healthcare professionals because they're focused on to people who are infected, but very creative thinking there. And I did talk to somebody who they had got 40 children living with social workers as temporary foster and replacement for the accommodation that was available. And another example of kind of people being really creative is moving residential provision into smaller clusters of units, so creating family units within. Ours are small anyway, so less of an issue. But also one example of using university accommodation, the residential accommodation, the universities are empty, nobody's there. They've got very tight, well furnished and very comfortable units with each with bedrooms, with bathrooms and ensuite facilities, as well as communal cooking facilities, etc. So actually some requisitioning of those kind of places for where there's need for an alternative residential provision. Some of the kind of risks and the challenges that are emerging is definitely we're seeing an increase in family violence. We're seeing an alarming, this is, by the way, when I say we, this is places outside Australia, we're seeing an increase in family violence in some places. There was a report last week, which you probably saw, New South Wales. In the UK and Europe, there's a worrying trend of unaccompanied minors left abandoned. So I was talking to somebody who runs children and family services in one of the largest ports in the UK, and last week they received 91 unaccompanied minors.
So
91. Yeah, they received 91 unaccompanied minors who arrived in boats, who were left outside the ferry terminal, and also there's been reports of children being left in cars outside airports. So I hope we don't see that here, but nevertheless it is a trend. Third area of challenge we're seeing is kinship care. Because many kinship carers are elderly, they're grandparents very often, then what we're seeing is a move to make sure there are alternative arrangements in place for all of those families, as well as arrangements, so it's not a traumatic move should that need to be instigated. And also there's a global shortage of personal protective equipment, and that's not going to change. So thinking smartly about when we use that and where we need to use that is really important. What seems to be happening around the world is that there's a general guidance that says if the child and family are non-symptomatic, then have contact but maintain social distance. But if they are symptomatic, either don't have contact, or make sure that you're fully protected, or engage with them in a way through health services. All in all, what's very, very clear is there is an unswerving focus, continued focus on the best interest of the child. And all of the creative thinking that's going on is all about how can we continue to keep children safe whilst maintaining staff well-being. I've got a couple more. So anyway, so yeah, so I will pause there to see if there are any questions.
Sonia, it looks like your slides have come up on the screen.
Oh, great! Yay! Good. I'll just do you want me to? There's a couple that we didn't look at. Let me
Sonia, can I ask you a question? It's a bit
yeah,
hard
sure.
to type because of my mind is going faster than my fingers can type at the moment. One of the things I'm confronted with for our staff, because we've been working from home now for a week, we were able to move very quickly to making that transition. But I'm also very aware of the impact for our staff, because traditionally for a practitioner, they leave their work at the office and they go home. We meet with our staff every morning, and it occurred to me this morning that they've got their work now sitting literally in their bedrooms.
Yes.
You know, so it speaks to this working from home, and certainly reinventing the remote, but staying well. And how do we look after our staff? Because we've talked about boundaries in our work and things like that. And I'm literally having a meeting and the staff is sitting there, and that's where she's spending her day. We've talked about routines and getting up, moving around and things. But could you maybe speak to, have you encountered this, and how do we keep our staff well through this as well? And as I say, that they're literally, their work is sitting in their bedrooms with them.
And we, as we've moved to remote working, as many others are doing a lot of work on well-being, workforce well-being, and for the very reasons that you've mentioned. So helping people to move to remote working. And I'm just going to go, I don't know who's got control of the slides, but can you go to the honeycomb slide? Here, that one, that's right, exactly. So so what we're seeing is a need to really prepare staff well to move to remote working, and a lot of that is about the challenges, because everything blurs. I've found it myself, is that I find it really difficult to work out like what time of day it is. I have gone to the new reality of working from home dress, which is smart on the top and casual on the bottom. But we have one, having a routine around the day. And what we've done with our workforce is we've put in deliberate virtual moments that help to structure the day. So we're doing a morning stand-up where we check in with everybody. We're also doing a virtual morning tea, which is not, so the morning stand-up is, what are we going to do today? What are we working on? How is everybody tracking? Then we're doing morning tea, which is, it is not at work, it's a social chat for 15 minutes where we just all dial in, we have our cups of tea, we talk about how things are going. We've been sharing tips and hints about how to make our working spaces appropriate. Many people are working from their bedrooms. We've also found that people in the early stages were spending hours and hours and hours. I mean, I spent one day like 10 hours just like this, sitting on a chair, doing call after call after call after call. So what we've done is we've structured our sessions so there's always a 10-minute break in between, so you've got time to go to the bathroom and walk around and get a cup of tea. We're encouraging people to really stretch the best and giving people stretch examples of what they can do physically, as well as helping them to share tips and hints about how we make our workspace more useful. We've also scheduled in walking meetings, a little bit more actually no, we can still go out as individuals, so not yet prohibited, but certainly the expectation that people go out and get some fresh air at 2 or 3 times a day. So saying let's have a walking meeting, it's invited, we can walk as we talk. so that we encourage people to get variety in their lives and stop. Because you're right, is it's so easy to keep on working and working and working. So we've also encouraged people to have passion projects. What's the thing that you're going to work on for you yourself while you're at home? So whether it's gardening or yoga, or it's the language or instrument that you've always wanted to improve and learn. So that kind of thing.
So Sonia, people have put up quite a lot of suggestions in the chat. I do particularly like Catherine's cat that just came into screen just before. I mean, that's one advantage about being home, because I love my cat. But also, those who've got Microsoft Teams, we've got it here. It really is a very, very helpful platform, as well as Zoom and others. So, you know, I think there's become a, you know, increasingly people are becoming more and more confident with this stuff, but it is different depending on the organisation. Catherine's actually got a question that came up on the chat. Yeah. Did you, Catherine, do you want to talk to that question? Or did you want me to? Just unmute.
Sorry, can you hear me now?
Yeah, I can hear you.
Yeah, sorry, I couldn't find the unmute with all the different things on the screen. Yeah, I was just wondering if you've heard anything from overseas regarding youth centres. I was quite worried when the announcement came out that youth centres were being closed down, because I know a lot of young people rely on them as a place for support, or also just a place to get away from their families and have a break, which is going to be more and more important as we go on. Do you know what's happening overseas?
Well, most of that provision has closed, but but where in the places that have kept their schools open, one of the other things they've done, so again in the UK, what they've done is they've kept their schools open all the way. They're keeping the schools open all the way through the holidays. It's a 365. No, actually they're taking weekends off, but it's 5 days a week every week provision that's available. And what's interesting is that to begin with, they found that there was low uptake from vulnerable families, but now they're finding that that's increasing more and more and more as time goes on, as people just they want to get out of the house. So it seems to me, what we're seeing is that schools where they're open, or early childhood centres, are becoming a hub, a community hub where people can go outside. There's also some really interesting, so some of the youth centres and youth services are providing virtual outreach and group chats and group activity sessions, so group craft sessions, group exercise sessions, and being very inventive and creative around that.
Okay, thanks. And is that, can I just ask one more question? Is that right up through secondary school that's doing that?
Yes, it is.
Yeah,
yes, it is. It's all ages. And so the other thing too is it's worth there are some companies now and organisations, particularly as fitness centres and youth services here have closed down, who are offering virtual services. It's really worth looking locally, and I'd really recommend connecting with the YMCA. The YMCA, as you know, operate through most communities in Victoria. They've got a really skilled workforce who are very experienced in working with children and young people. They're all police. Well, most fitness and exercise sports centres people are. They're police vetted and have got their working with children checks, etc., as well as being experienced in running activities. So it may be worth exploring whether it's possible to commission somebody in on a local basis to actually run programmes specifically for your youth cohort.
Yeah, we're actually planning a webinar on e-youth work a bit later this week, so we'll put that out to our members and anyone else who wants to be part of it. But I'm just a bit concerned. There are a lot of young people who don't have access to devices or internet at home, or certainly not in a private way. So there needs to be some kind of physical escape for them as well. Absolutely. So I like the idea of the schools providing that. Yeah,
absolutely. That's good, thank you. So we didn't look at this slide, that the honeycomb slide, and somebody's asked questions, can you have these? Yes, you can. We'll send them out later. But one of the things that we know really, and you've probably already done this, you'll have done a risk assessment of your workforce. In particular, one of the really important things is to know anybody who has got a significant underlying illness that would make them highly vulnerable, and immediately move them to remote working or back office working. And then, like, what are the services that that you're going to continue to deliver, and how can you do them? Workforce resilience we've mentioned, and then the rest of it is all about workforce preparation, moving to remote working, and also managing any face-to-face contact, however that will fund. The thing I will call out, because I've seen this not happening so much in many places, is the importance of workforce resilience, even at CEO level, is that in order to continue working in this extraordinary time when we're going to be balancing personal challenges along with workplace challenges, and it's very likely that some of us will get sick as well, hopefully few, but it's probably going to happen. Then how can we all need to be working in pods of 3 or 4, where we've got somebody who can step in behind us where need be. And as things get really tough, that we exercise really strict rotas. So a lot of places now are operating A, B, C and D teams. So you have a team who are on, and then you have the replacement team, and you're operating strict rotas. So you keep your workforce relaxed. And going back to the question you were saying earlier about people working continually, that helps to mitigate against that. But also, so we give everybody breathing space, we keep people mentally well as physically well.
So Sonia, there was a question earlier that was talking about workforce shortages. Now clearly your earlier comments about using workers to be carers and those types of things, caseworkers, etc. How, because workforce shortages are already an issue.
They are.
But what we're seeing that's creative across the world around addressing some of the workforce shortages that we're going to have anyway as a consequence of the illness.
Yeah, what we're seeing, and you'll have seen examples here. So say so you're seeing Qantas, immediately reskilling their workforce to go and help out with Woolworths. Oh, hello.
Hello. It's gone. It's gone.
Never mind, I'll let somebody else. We've seen Qantas working with, here's some examples. So we've seen Qantas, who suspended 20,000 staff, retraining them to go and work in Woolworths. We've seen the Scandinavian Airways, who have actually trained their staff as health workers. I think for us, the big workforce that is going to be the most easily accessible and ready to go is the, as I mentioned earlier, the organisations like the YMCA and the sports centres who are closed down. Their staff have been stood down. They're a very quick skill match and could be easily trained. So what we're suggesting is that you look at local workforces who are stopping. They're in that third group of organisations who will be no longer able to deliver, and look at which are the groups that match best and have got the nearest skill set to you and could be your contingent workforce, and talk to those organisations now. Like, so we're already having some of our clients reach out to us and say, can you provide us with X? We placed 22 people on Friday where they were looking for analytic skills. So where are the places where you're going to get the nearest match? Team up with them now, and that's the really good thing about that, is they can be a contingent workforce. They can stay employed by their main employer. They can work with you on a contingent basis, and then they can return to their employer when things get back to normal, which is what Qantas and Woolies are doing. Then where's the next nearest and the next nearest? And then there are organisations like, which you probably use anywhere, so the big employment agencies are already gearing up to transfer their workforces over and train them up. So one of the demand areas we're seeing and that we're doing some work in is how can we provide rapid skilling immersion processes so that we can help people to be a good workforce as quickly as possible.
Sonia, I would be interested to know if you've come across, one thing that we've been exploring is that we have a lot of members, supporters, volunteers who are now at home, and a lot of mums that we work with, at-risk vulnerable mums, who are obviously experiencing additional pressures, stresses. And we have been thinking about doing, say, some virtual training for our volunteers who may want to volunteer themselves at home just to be on the phone, not like a lifeline, you want to not be lifeline, but say being available if a mum wants to connect and have a chat to somebody, and doing it with the Zoom or WhatsApp, because I think the visual is really important just to connect. And just somebody who's outside a professional, checking, surveillance type of work, but more that connection and reassurance. Have you come across anyone who's doing something like that, or
like a peer support, Jen? Like a peer
Yes, and already I would say, and I guess I'm drawing on my experience in the UK here, but certainly that kind of support network exists anyway. So moving it to virtual is really easy, because that kind of notion of here's a buddy system, and we're seeing lots of places in terms of the well-being, looking at volunteers, providing some training, and then having a buddy connection system where you can match people of either, whether it's a similar age or even the kind of experienced person with a younger mum or dad. That kind of thing is really, really helpful. So again, establishing a local register of and putting a reach out, because lots of people, again, this goes back to the people at home wondering what they can do. We all need things to do, and we know that one of the most protective things we can do for our mental health is to be generous to others and help out. So actually reaching out for volunteers is a great thing to do, and there'll be lots of people who will be so glad. And particularly what I'm seeing and hearing is in the aged care section, older people living at home who suddenly don't have any contact with their grandchildren, and they're a bit of a loss, they're bored. So again, giving them something safe to do, something virtual to do, but nevertheless uses their life and experiences really worth.
So can I ask a question? It's Luke here from Upper Murray Family Care. So Sonia, through you to Deb, that point about related workforces and a workforce, as you know, in some program areas there are very specific mandatory qualifications, e.g. financial counselling. Has there been any conversation you're aware of at a government policy level about re-looking at that? Because we haven't got a choice. You either have that qualification or you don't.
Yeah, so there's a lot of discussions about what can be relaxed. I don't know in relation to that specific qualification, but there's a lot of conversation and discussion and exploration about what can be relaxed. And it goes back to this whole thing about which is the 101 in business continuity planning, is what's essential and what's not. And so it's being really clear what do we absolutely need, usually relating to health and safety requirements, what's absolutely critically essential, what can we drop, what can we relax, and many of the registration and qualification requirements relaxations we're seeing are there. Dean, you're on the line. I don't know whether you've got a comment on that in relation to financial, or Cam?
Well, not actually financial itself, Sonia, but more generally, we've seen over the last week government is very open to conversations around flexibility where it's appropriate and where it's needed. I'm not saying that it's guaranteed, but just given the breadth of issues that are on the go at the moment and the extent of concerns about whether appropriate workforces will be in place, I'm very confident that government would be open to discussions about making adjustments, where it's feasible and possible and where it's appropriate. That there's certainly more open-minded to it at this very moment.
Yeah. So and also there's a question there about working with children checks and police checks. I know that with working with children checks that the department are looking at how they can, if they haven't put it in place already, about how they can move these things more quickly, because there's that whole challenge, isn't there, between how do we make it really easy for the right people to get into the contingent workforce as quickly as possible, but also how do we make sure that we prevent sadly, in our world, we know that there will be people who will be looking to use this as an opportunity to cause harm. So how do we make sure that we prevent those people from coming into contact with children during this? So it's that kind of like fine balancing act. Any other questions? I think I can see that people, we're getting into the last few minutes. Any questions?
Sonia, I'm just interested, because I think the other issue is that there are some incredibly skilled workforces that actually, so there's the sort of peer support. You can transition really people with the right values into particular work. Yes, we need more carers, but there are people, particularly skilled counselling people, who really you've got big issues in the co-parenting arrangements now with the courts, where you've got arrangements that need to be organised between parents who aren't living together. There's some real skill required in some of this work. I'm just not sure how we conflate that. And so maybe the reality is, for some of those workforces, we need to continue to keep them well, because we need them to do some of that really skilled, almost paralegal mediation work. And then you've got those things that maybe you can bring others in to support you with. Would that be your advice?
Absolutely. So if you look at I'll give you a practical example here in Australia, is that in terms of health services, which has been, it's a all hands on deck. If you've got any, like, say, for example, if you've got any health experience, if you are a trained medical professional in any way, but you've been through that basic kind of medical training, you are in demand. And then there's who are the other people who can sit behind that workforce and allow them to step up. And that's where, though, I mentioned earlier, these different layers we need to think about. So when we look at our workforce, who are the people who've got skills that nobody, they cannot be done by anybody who doesn't have those skills. Where do we support those, and then who are the people who can take off some of the other roles and responsibilities for those people, so that they can so that you've got an allied workforce who are enabling the people with the critical skills to focus just on those critical areas. And then there is the wrap around those people with the critical skills, going to your point around counselling and other things, where they can draw them in as a team, help them under their supervision, and then but also help to keep them well. So what support do we provide to individuals who are going to be working really at the hard end of delivery? And one thing I didn't mention earlier, but that I should have done, that came out through my scan of the world this weekend, was that supervision is proving to be very, very important. How we continue remote supervision, which is where the point I made earlier about the case note recording is very, very important.
Thank you, Sonia.
So I'm just going to draw in Cam or Georgie or Mel or Dean, anything that you would want to add, and keep your questions coming.
Hi Sonia, it's Cameron here. Probably just a continuation of the point you made then, and it might be something that governments need to further consider, is what we are observing is the essential services in the entire care space, from health to aged care to disability to child protection. There's almost an increase in demand for the need for people for two reasons: A, to respond to the crisis, but also to respond to fatigue that will potentially come. Just everyone's on heightened alert to maintain services, and so looking for opportunities to have workers more mobile across the care sector is something that certainly it might come out of the disability space as governments work out solutions to maintain services there, but certainly for providers that are seeing parts of their operations reducing because of isolation measures, thinking about the complete skills that those people have and where they could be redeployed in the care system is something worthwhile thinking about.
Definitely.
Good. I'm just looking at any other questions that have come through that thing. Lots of workforce issues, which we know, and this is we've just got to build a contingent workforce and probably work together. So even sort of like if we thought about ourselves as a whole, a sector workforce, and how we can team together, because the way this virus will run is it will run round specific locations and teams. So what we're probably likely to see is gaps in particular areas at particular times. So being able to work to pass work over. And again, somebody I was talking to at the weekend was saying that they're already modelling what they would do for different caseload shifts. So normally they might have in the region of, say, for example, between a caseload of between 8 and 15, depending on the complexity of the children's situations and circumstances. But they're modelling up to, well, what would happen if we went to a caseload of 1 to 40?
So Sonia, I've got another question. So
Yeah.
What's your sort of intelligence? There's a couple of things. What's your intelligence around? Look, we're hearing here in Victoria that there's huge demand on counselling services. So already families, individuals are seeking out the virtual online counselling that they might need. Are you hearing that sort of? So already some cohorts are already behaving differently. They're not always wanting face-to-face, but they're wanting online. On the phone, on sort of FaceTime or Zoom. Are you hearing that across the world? Is that a sort of a common cultural shift? Because I think, I can say in terms of our membership, you can see all of them, they've almost, they're setting themselves up for success. Obviously there's a bit of a leap for some, but for the most they're able to move that way. And are you seeing that that's the way that's going to be the change?
Absolutely. And also, I think that raises another interesting point about how can we really leverage and strengthen opportunities for self-help in communities. So that what we do is we keep well functioning and well families well functioning. So that and one of the things that we've been working on is, how can you create a self-triage system? So there's quite a lot of work on that in some areas. So setting up self-triage, so families can themselves say, actually here, and and if you think about some of the fabulous resources we've got locally in Victoria and Australia, so say for example, parenting support packages, etc. So how can we do that? How can we connect with local counsellors and other people who can help? The Beyond Blue services, but also a plethora of local people who can also support. So we need to map out that and move quickly to set up that opportunity for self-help wherever possible.
Deb, can I?
Hi Rita, how are you?
I'm good, thank you. Can I ask a question?
Of course.
I'm just wondering, with regard to family violence, behind the rest of the world, if there was any evidence of the lull before the storm.
Great question.
Yeah, we're definitely seeing. So what certainly from the contacts I checked in with over the weekend, then yes, what they're seeing is a reduction in reports and a significant increase in family violence.
But I'm just wondering around around the increase in family violence, if there was a reduction in number of people seeking help before it began to increase.
Oh, I see what you mean. So actually, I don't know that I don't know whether that's the case or not. But what I was told by one person I spoke to was that what they'd seen is some families definitely going off the radar. And so they've, again, in their RAG ratings, what they've been doing is watching for that. So who is not connecting, who has disappeared, and then deliberately seeing that as a signal to check in.
It does sort of make some sense with regards to the isolation, the social distancing and isolation, where women and children and perpetrators are locked in the same home, and access to mechanisms and safety plans that were useful in the past are not. And so there's actually a decline at the moment in that that first moment across a number of our specific core lines, national and state. And if that
actually, interestingly, because it'll be just, I mean, when you're in this, when everybody's at home together, there is no safe place to make a call, is there?
No.
So you are, and particularly if you've got a very vigilant abusing partner in the house, it's going to be very, very difficult to do that. Interestingly, I hadn't thought of this till just now, but I mentioned the example earlier of one place where they've been using university accommodation as temporary accommodation for 16 to 18 year olds, vulnerable 16 to 18 year olds. But actually it'd be really interesting, because you've got, it's the kind of the same we're doing with hotels with people who've just arrived back from overseas, but there's enough vacant, high quality accommodation available at the moment to think about how can we create some more escape routes for people. But also,
it's not a question of accommodation. I think that
no, contact.
I think it's more the initial contact and the lull before what we might see as more police reports. And I think that that we've had some experiences with children being out of sight as well, because many are not at school. Reports from women who are already getting anxious, there's evidence of some really high risk stuff going on for women and children, and they're out of sight totally. Yes.
Well, so what I did hear very strongly over the weekend with my various conversations was, one, anybody who is out of sight is absolutely up there on the red of the RAG rating, because that is an alarm bell ringing. And then also using phones and iPads, etc., and still insisting on seeing the child.
Yes, correct. Yeah. But just we have examples of where even child protection have got such pressure on them that they're even not responding to what we would identify as high risk.
No, I just wonder whether there's some, I think that's an area that we could helpfully explore in more detail and think about how we can use discrete approaches that would work in the most overlooked environments, so that we can give those mostly mothers and their children kind of like that thread through to safety. But I think the main thing is, if a family suddenly drops off the radar and there's no contact, we have to reach out.
Yeah, Rita, we would absolutely agree with you. We're really quite concerned, because the normal systems that sit around us, so schools, GPs, nurses, early years, maternal child health nurses, all of these have become remote for a whole range of reasons, and family services workers and family violence workers are really concerned. There's not that early warning system in the way that we used to have that would allow us to sort of get a sense of what was going on. We're entirely now relying on mum and or whomever to tell us what's going on. And I think that, Rita, I might take it offline with you, because we started to sort of think about this a bit more.
And the only thing I'd say as well is definitely having those children in vulnerable families and families where we know there is a history of family violence, then supporting the children to get to the school and early childhood services, so that they can actually they are physically present on a daily basis and they are seen by adults outside the family. Is really, really important. Of course, then there's the opportunity for mum to take them to that provision, although I know sometimes that wouldn't be, that would be deliberately blocked. But I think that is a really important route for us.
Thank you. Other questions or comments? We've got like 5 minutes to go. 5 minutes. Just to let everybody know, we are going to get the slides, aren't we, Sonia? So
yes, you are. That's right. Yes. Yes.
And Emma Femby from here, she's on the Zoom and she's been taking fantastic notes, haven't you, Emma? And so hopefully we can get at least some highlights out to you today.
Yeah, we can do like maybe some frequently asked questions or something like that, and then pull those out. Yeah, good. And also to say as well is one of the things that we've been talking to Deb about is we're really happy to continue to support chats about, you know, we're working across nearly every industry and every service around the country, helping people with this preparation phase. And also we've got a mindful eye to recovery. Because in a few months' time, you know, we need to just keep, you know, we need to keep our eye on, let's deliver the most important things at the moment and make sure we've got the people to do it. But we have to also think about recovery, because this will come to an end. And we may be going into a new normal where we have to do things very differently for the foreseeable future, but nevertheless, recovery is going to be equally as important.
Yeah, you're right. You're right.
Sonia, just a quick comment from me, if that's okay, just very quickly. It's Dean Yates here. What we're seeing, and this is not just a human services organisation issue, this is right across the board, all types of organisations. One thing we're seeing, the organisations that are more on the front foot, if you like, or getting better prepared, is that their leaders, managers, people like yourselves, particularly if they're working remotely, are carving out 10, 20 minutes of their day. And it might be when you go for the walk at the end of the day, but just to, and this is perhaps telling you how to suck eggs, I know, but it's really important that you keep remembering this, because we can get dragged into the weeds really quickly. But just a few dot points, some mental checklists around things as leaders and managers we need to be thinking about that our staff or teams don't have time to think about, the sorts of organisational issues and risks that you need to be thinking about on a daily basis, but also just planning a little ahead, a week or two ahead. Carve out some time to do that and just monitor progress against that. The big organisations are doing it, the small ones need to as well. And the onus is on all of us, I think, is to just carve out a little bit of the daily headspace and thinking from the weeds, from what's happening right now, to think a bit about the week or two ahead. And unless you take the conscious step to do that, it's very easy to get distracted by the things that are happening right now.
People have comments about that?
No, I was going to say, yeah, we have to stay on the balcony as leaders, and also make sure there's somebody, at least a couple of somebodies behind us on the balcony to step in, and so that we get some respite and breathing space as well.